The beginning of my asthma started probably when I was 46, 47 years old. I didn't really realize what was happening, but as I got into my 48th year, I noticed a significant difference, and that's the first time that I went to see Dr. Basha. I would say probably in my 69th year, 68th, 69th year, I began to notice inability to do things and do them as long as I had done them before. And not because I wasn't physically able to do them, but I would tire very easily, and it was difficult to breathe as I did them. My doctor is Mike Basha. I've been seeing him since I first had my issues with asthma and been seeing him all the way along. And about a year ago, I had quite a severe attack. So he sent me home, no visitors. I couldn't go out. No one was to come in. And about 2 weeks after that began, I had some improvements. And he said, well, I'm going to schedule you for an appointment in early 2015. He says, I'll talk to you then about what I want to talk to you about, which is what I did. And when I went into that appointment, he gave me two options. One was a drug treatment that you had to first be tested to see that you were not allergic to the drug. And the second was a relatively newly approved procedure called bronchial thermoplasty. So I said, I'm going to try it. And we scheduled for my first procedure in early April. And then in August, I went to see Mike again. And when he did the procedure, the testing of the ability to inhale and exhale, he said my ability to inhale and exhale was greater than what it was when I went to see him at first time 48, 49 years old. Well, the activities that I engaged through my whole life were outdoor activities. I hunted, I fished, I golfed, I swam, I kayaked. I loved hiking, I loved walking, but those things became more and more difficult to do. Not that I didn't want to do them, but I'd get maybe a half hour into them, an hour into them, and I was physically exhausted. And I noticed that I was, breathing heavy as I was doing those activities. So I just kind of, probably in my late 60s, I started to think, well, maybe I have to give these things up. And I did to a large extent. I'm back doing them now. So I'd recommend McLaren Port Huron because I felt great confidence in the staff. They treated me like an individual, not a number. They talked to my wife while she was there, kept her appraised of where I was in my process and my 3 processes, and I was just very comfortable with it. I have told everybody that I know in my questions and answers, I've told them about the quality of service that I received at McLaren Port Huron Hospital.